Welcome back. In today's video, we are going to discuss about the miscellaneous methods of contraception. The miscellaneous methods include sexual abstinence, coitus interruptus, safe period, also known as rhythm method or calendar method. Natural family planning methods, which includes basal body temperature. We see that it includes the basal body temperature method. And then we have cervical mucus method. We have cervical mucus method and symptothermic method. The other two methods include breastfeeding and birth control vaccine. Each of these methods will be discussed in the upcoming slides. Let us start with sexual abstinence. So sexual abstinence, we see that it is the only method of birth control which is completely effective. That is sexual abstinence. The completely effective method is completely 100% effective is abstinence. So what is abstinence? When you restrain yourself from indulging into something. Now when you restrain yourself from performing the sexual intercourse, so there is no chance of fertilization, complete stoppage of sex. So it means that there is no way a fertilization can occur, and in this way it acts as a miscellaneous method of contraception. So let us see that it is a non-physiological method where there is complete sexual abstinence and the only method which is completely effective. Now there are some drawbacks of this sexual abstinence, wherein a person has to repress the natural force. He has to manifest itself in other directions, like temperamental changes or nervous breakdowns can occur in the women. So we see that such conditions are observed in people who perform the sexual abstinence. The nervous breakdowns and the temperamental changes are quite often observed. So this method cannot be advocated to the masses as a method of contraception. Now, moving on to coitus interruptus or withdrawal method, which is the oldest method of voluntary fertility control. We see that the coitus interruptus, also known as withdrawal, interrupt is to withdraw. Before the ejaculation occurs, they withdraw. Now, we see that it is the oldest method of voluntary fertility control. It involves no cost or appliances. It's just the withdrawal of the penis before the semen is ejaculated into the vagina. So the withdrawal method includes no cost or appliances. It is a very widely practiced method. The male will withdraw before the ejaculation and thereby he will prevent the deposition of the semen into the vagina. Some couples, we see that they practice this method successfully and without any difficulty to manage. We see that there is a wide usage of this method. Also due to certain ethical reasons, also people prefer the withdrawal method. But then there is a certain, it is a non-physiological method. Yeah, okay, it's a non-physiological method, but there are certain drawbacks of this method. The pre-ejaculatory fluid, right, that is what is that, a drop of semen, which is even the precoital secretion. It, even if it contains a drop of semen, the precoital secretion, if it contains a drop of semen, what happens? It will be sufficient enough to cause the pregnancy. So the slightest mistake which is done in the timing of the withdrawal, in case such mistake is done in the withdrawal timing, then if unfortunately there is a deposition of the semen in the vagina, then the failure rate can occur. Failure can occur, and the failure rate accounts very high in cases of coitus interruptus, which is about 25%. So we see that 25% failure rates are observed. So this is all about coitus interruptus. Now we are moving on to safe period or rhythm method. Safe period, rhythm method, which is also known as the calendar method. Now this method will be based on the fact that ovulation occurs from 12 to 16 days before the onset of menstruation, on which the conception is likely to occur. So what do they mean? So menses, dated 12 to 16 days before menses, ovulation is likely to occur. 14 to 16 days before, what happens? The 12 to 16 days before, what do we get to see? We get to see ovulation occurring. Ovulation, when does it occur? 12 to 16 days prior to the menses. Now So they say that prior to the menses, prior to 12 to 16 days of menses, half a month before the menses, 15 days back, roughly 12 to 16 days back to the menses, that day the ovulation is likely to occur, and it is the highly fertile period, ovulation period, during which the fertility rate is very high and the conception is likely to occur. Here the safe period wherein the women has to do the potential calculations, so we see that it is associated with no costs. Programmed sex, it is also known as programmed sex because there is abstinence which is required for half month. So we can see that here the most fertile period from 8th to 19th, half a month almost, the couple requires abstinence. So we see that it is programmed sex. This the other half, the infertile period, they can perform the sexual intercourse. So we see that the half a month the abstinence is required, so the woman is programming the sexual intercourse. So we see that it is also known as programmed sex. The first day of fertile period and the last day of fertile period. How do we calculate the first day of the fertile period? Using the safe period, you can calculate the first day as well as the last day of the fertile period. Now you can see in the picture here. Yeah. This picture, we see that 26 and 32. Now the 26 is the shortest cycle, 32-day cycle is the longest cycle. When you subtract 26 minus 18 days, it gives you the first day of the cycle. 32 minus 11 day will give you the last day of the fertile period. This gives the first day of fertile period, and this way you can calculate the last day of the fertile period. Now let us see what they have written. You can make out, right? 26 and 32. Subtract minus 11 from 32. 26 minus 18. It gives the first day of the fertile period. This gives the last day of the fertile period. Now you see here, first day of the fertile period, the shortest cycle minus 18 days. The last day of fertile period, longest cycle is for a period of 32 days minus 11 days. The failure rate in cases of safe period is 24 per 100 women years. So the fertility rates are high, and the failure rates are fertility rates are also high, and the failure rates are also high. It means that there is more failure occurring in cases of safe period. More likely the women becomes pregnant. The complications in cases of safe period includes ectopic pregnancies and embryonic abnormalities. We see that there is ectopic pregnancies occurring. It may follow the conception late in the menstrual cycle, and there could be a displacement of the ovum resulting in ectopic pregnancies. The embryonic abnormalities which are occurring, it could be the result of the conception involving an overaged sperm or overaged ovum. In cases of safe period, when there is some disturbances in the programming, what happens, this ovum, even if it is lasting, or the sperm is lasting, then what it does, the overaged sperm and the overaged ovum, when the ovum and sperm is overaged, the zygote which is formed out of it, it is likely to the fetus is likely to contain some congenital embryonic abnormalities. Now safe period can also be observed by using temperature, rhythm, or cervical mucus method. Now the other methods which we will study under the natural family planning methods, that is basal body temperature, cervical mucus study, symptothermic methods, all these by using these rhythm or cervical mucus method and the temperature method, by using these methods as well, the safe period can be calculated. So we see that here the menses, 1 to 7 days menses, during which the woman is infertile. Starting from the 8th day to 19th day, the semi fertile period occurs, during which from the 11th to 16th day it is the most fertile period, followed by 20 to 26th day or 32 days she is likely to be infertile. This is how we calculate. Okay, now let us see the natural family planning methods. Starting with the basal body temperature method. So, under the basal body temperature method, it depends upon the identification of a physiological event, wherein the rise of the basal body temperature at the time of ovulation. At the time of ovulation, what happens? The basal body temperature increases. It is because of the increase in the production of progesterone during ovulation. At the time of ovulation, what happens? The increased production of the progesterone occurs, so the temperature slightly raises from 0.3 to 0.5 degrees Celsius. So we see here, rise of the basal body temperature at the time of ovulation, it is due to progesterone, and the rise is 0.2 to 0.5 degrees Celsius during ovulation. When no ovulation occurs, the basal body temperature does not rise. So by this, now you can see during menarche, just before the first menses occurs in the childhood, in the girl, when before attaining the puberty, there is no alteration in the temperature. Whereas once she attains her menarche, once the menstrual cycle starts, so on the day of ovulation, 0.3 to 0.5 degree or 0.2 to 0.5 degrees Celsius, there is a slight increase in the temperature. Also during lactation, when there is no menstrual cycle in the initial month, during lactation, there is no ovulation occurring. The body temperature does not rise even during lactation. The temperature is measured before getting out of the bed in the morning. So now, when do we measure this temperature? She should make a routine to check her temperature before getting out of the bed in the morning. It is reliable. This method is reliable if the intercourse is restricted to the post ovulatory infertile period. If she is following that rhythm method, and if she is doing the post ovulation, that infertile period, if she is starting the restricting herself during the fertile period and performing the act during the infertile period, then she has to measure the temperature rise after the ovulation. She sees that the temperature rises, and the main drawback of this thing is abstinence is necessary for the entire pre-ovulatory period. Guys, now we see that what happens in this. She is supposed to measure her body temperature every day before coming out of her bed. And then, if intercourse is restricted to the post ovulatory infertile period, only then this method is reliable. She has to keep a track of her fertile period and infertile period, and the temperature will be continuously raised up to the beginning of menses. So once the ovulation occurs, the slight increase is there in the temperature. It will continue to remain until the menses occur. And also we saw that she has to have the complete abstinence from sexual intercourse during the pre-ovulation period. During the fertile period, she needs to have the abstinence. So this is a kind of a drawback. Moving on to cervical mucus method, billing method or ovulation method. Here the cervical mucus method, which is also known as Billings method or ovulation method. So what happens? We have a change in the cervical mucus consistency. At the time of ovulation, what happens? The cervical mucus will become watery, clear, resembling like the raw egg white at the time of ovulation. Remember guys, ova, egg. So like raw egg white. The ovulation, at the time of ovulation, how is the cervical mucus? The cervical mucus will be like egg, raw white egg. Raw egg white, and then it will be smooth and slippery. Once the ovulation occurs, what happens after the ovulation occurs? There will be a progesterone in the body. There will be an influence of progesterone. So the mucus starts thickening up and the quantity reduces. Under the influence of progesterone, the mucus thickens and it lessens in the quantity. Moving on to symptothermic method. In symptothermic method, it combines the temperature, cervical mucus and calendar technique. All of the three. This method combines the three things. What are those, guys? Temperature, cervical mucus, calendar techniques in order to identify the fertile period. She does this to identify her fertile period. If the woman cannot clearly interpret one sign, she can double check her interpretation with the other. So if I'm just doing the calendar method, if I'm not very sure of the day of ovulation, if I am having a confusion regarding the fertile period or infertile period, I can make sure I can cross check with the cervical mucus method, wherein depending upon the consistency after ovulation, how will the mucus become? It will become thick and it will become scanty, whereas prior to ovulation it will be smooth, slippery, watery, like raw egg white. So by this I can cross check if the calculation is correct or wrong. So it is more effective than Billings method and basal body temperature method. Therefore this method will be the most effective method because it includes all three things. Moving on to breastfeeding. Breastfeeding lactational amenorrhea method. Breastfeeding is also known as lactational amenorrhea method. Lactation prolongs postpartum amenorrhea and provides some degree of protection against pregnancy. So we see that the lactation will prolong the amenorrhea during the postpartum period. It is going to prolong the amenorrhea and it will provide some degree of protection against the pregnancy. We have studied all of this in OBG. You can check out the videos in the playlist. We have studied, and it's a revision again in SPM, that the lactation will provide a contraceptive effect. However, once the menstruation returns and the continued lactation no longer will offer any kind of protection against pregnancy. Once the postpartum period, the woman starts getting her menses, then even though the lactation is continuing for a period of 2 years or what so, there is no contraceptive effect. Once the menstruation returns, the contraceptive effect against the pregnancy is lost. By and large, we see that by 6 months after childbirth, about 20 to 50% of the women are menstruating. We just see that after 6 months of childbirth, the woman starts menstruating. Around 50% of the women are almost menstruating and they are in need of a contraception. Moving on to the last point, that is birth control vaccine. In birth control vaccine, we see that several immunological approaches have been done to both men and women. And the most advanced research, it showed that the research of the most advanced one, it showed that the immunization with an vaccine which is prepared from the beta subunit of the human chorionic gonadotrophin will produce, which is produced in early pregnancies, it will block the continuation of the pregnancy. So we see that GnRH vaccine are given that would block the continuation of the pregnancy. And we have other birth control vaccine for gamete production. We have GnRH vaccine, luteinizing hormone vaccine, follicle stimulating hormone vaccine. For gamete function, to stop the gamete functioning, we have zona pellucida vaccine and sperm vaccine. For gametes outcome, we have HCG vaccine phase 3 trial. So the uncertainties in cases of these birth control vaccines are high. So the researchers are still continuing with regards to this. So with this we complete the thing. Now let us revise this. For the gamete production we have GnRH, LH, FSH. So GnRH, so we know hypothalamus GnRH, pituitary LH, FSH. Okay. So this is done. For gamete functioning, zona pellucida. For gamete functioning, we have zona pellucida vaccine and also sperm vaccine, zona pellucida and sperm. Outcome, for the gamete outcome, HCG, human chorionic gonadotrophin vaccine. I hope the vaccines are clear. There are high uncertainties, so not very sure. Thank you. With this we come to an end of the miscellaneous methods. In the next video, we'll be discussing about the terminal methods of contraception.